Hello, everyone. This is Functional Friday. This is a live session that I do with my clients within Anti-Gravity Wellness. What we do is we discuss topics related to perimenopause and menopause, and my clients have an opportunity to submit questions and also get them answered live. And today, we're talking about hot flashes, sleep, and weight gain. These are some of the top issues that come up in my clinic, in my practice, when women come to me seeking help for perimenopause and menopausal care. I run a telemedicine practice here in Washington State. And this is such an area of need. I was just at the Women's Expo last weekend, and it was amazing. We were busy. I was thrilled. It was great. And I got to talk to so many amazing women who were just struggling. They have had these issues: weight gain, low libido, trouble sleeping, hot flashes, and they're being told that either they're too young to be in perimenopause, which if you're over the age of 35, or if you've had a hysterectomy, even if they left the ovaries, that can kick you into perimenopause a lot sooner. A woman who was 47 was told she was too young. Average age of menopause is 52. The average duration of perimenopause is anywhere from 2 to 7 to 10 years, by the way. No, right in that range. The lack of education for what women go through and the duration of it and the treatment of it for perimenopause and even menopause is depressing. And I'm speaking from someone who was trained in Western medicine. I've been working in a hospital setting in acute care medicine for the past 11 years, almost 12 years now. We don't talk about it in school. We don't get taught this. Our medical doctors don't get taught this. All right, first let's talk about hot flashes. What are they? They are a sudden feeling of warmth, often intense, that are usually most severe over the face, the neck, and the chest. And they may cause some sweating and some rapid heart rate. I've heard women describe them as their personal summer, and they can come on for like no reason. It's really irritating and can be very debilitating in a woman's quality of life and also her sleep, which we'll also talk about in the next little section here. So why do they happen? What's going on here? Well, what's going on is they are being triggered by these hormone fluctuations, most notably estrogen. However, it should be noted that it's not just estrogen declining that can cause hot flashes. There are other underlying issues that we want to look at. What's the thyroid doing? What are the adrenals doing? What's the gut health? These things, if they're not optimized, and very often through perimenopause, they are not optimized, we're having more issues, not less, that will make these things worse. It can exacerbate your hot flashes beyond what the estrogen is doing. It's very important to look at the entire picture and pull this together. And oftentimes I find after I do a full evaluation, we do functional labs, we do a Dutch test, which is a dried urine test, cortisol testing, even a GI map to look at the stool and what's going on in the gut, and find that we have a couple areas of concern that we need to systematically go through in order to have the woman feel better and finally have that quality of life that she has lost. She doesn't feel like herself. She's not acting like herself. And it's frustrating for her and very bewildering to everyone around her as well of what's going on. And it's really hard to talk about. No one wants to talk about menopause, but we need to talk about it. It's very important. It's a huge, every woman is going to go through it. Literally every single woman. It does, if you're born a female, you don't get to escape this. So some things that we can do about this. There's lifestyle solutions. You wear layered clothing, so you can quickly strip things off and then put things back on as the hot flash passes. You avoid triggers such as caffeine, alcohol, spicy foods, and stress. Good luck with stress, right? These things will definitely exacerbate. Having practices around stress management becomes even more important. It was always important, but now it's even more important as we're going through the transition here. And not everyone will suffer from hot flashes. So it's not to scare you if you are not suffering from hot flashes. You're like, oh God, I don't want to do that. Not everyone does, but a vast majority of the women going through perimenopause do have this issue. Yoga, meditation, deep breathing, these things are really pivotal, especially if we're also having issues with the cortisol levels and chronic stress and adrenal adaptations that kind of downregulate that system. Adrenal fatigue is the common name for it. It's kind of a misnomer. That's not necessarily what's going on there. That's why some people are, that's not a thing. Well, okay, It is and it isn't. It's kind of semantics, which are important. Words are important, how we describe things, but it's a downregulation of that system. As you know, you're chronically stressed, then the system goes, okay, obviously this isn't going to change. We're just going to lower things down. He's tired. So you're going to can you get sick? You've been working really hard and then you finally have some time off. And then of course you get sick. It's because your body's been stressed out for so long and it's been holding on. You probably got sick a while ago, but your body's been holding on, holding on, holding on. And you finally have a moment to relax and then you get sick. It's this similar kind of a thing. Like your body is going to figure it out as long as it can. But once it has the opportunity to, it's going to shove you down and be like, all right, you're done. You need to relax. You need to rest and we need to recover because you've been pushing it too hard. We're not machines. Unfortunately, I know we try and push ourselves. Other things we can try, there's like cohosh. Some studies show might be beneficial. Others say not so much. We do have to watch out for liver issues with that. Soy isoflavones. Usually though, we're talking about the non-GMO fermented type of soy. And it's interesting too that genetics plays a role into this. Typically, the Caucasian population doesn't have as many benefits from using soy as the Asian population does. Probably some evolutionary things contributing to that. And it's a slow game. It can take up to a year for incorporating soy into the diet and even with supplementation to show a benefit for hot flashes. Evening primrose oil is also something that can be used. Again, though the research doesn't necessarily support that it works super well, but I'll also preface this with the fact that there's not a huge ton of research done on women in general, and especially through perimenopause and menopause, because we're already complicated as it is, right? When you see a lot of research studies that are done with women, they're either done postmenopausal when hormones are flat, or if they are done with cycling women, they're done in the follicular phase, because and this follicular is first phase, so that first half of your cycle, whereas then you ovulate and then there's the luteal phase, late phase. The luteal phase tends to have more fluctuation in hormones and metabolism and things like that, whereas the follicular phase is a little bit more even keel with a lower metabolism. So you can do a little bit more there, higher metabolism towards the last half of it, which makes sense because the body's getting prepared for possible pregnancy. But a lot of the studies aren't done on women who are going through perimenopause because guess what? Especially towards the late phase of perimenopause, stuff gets crazy. That's why they say, oh, we don't want to test hormones because they're unreliable, which I agree and I disagree. We still want to know what's going on, but keep it in the context of her cycles, her symptoms, and everything else that's going on, which we should be doing anyhow, right? This was a super interesting article. It talks about non-HRT hot flash treatment. That was one of the questions that I had a couple of times at the expo last week when I was talking to some women. They said, I was told that I can't take hormone replacement because of XYZ, but I'm still having symptoms. This is from, this is guidelines right here. Let's say we're trying to treat vaginal issues, genitourinary issues related to menopause. When we lose estrogen, one of the things that the estrogen was doing was keeping those membranes nice and soft and thick and healthy. So we lose that estrogen, it gets thin, dry, and frail, and can cause a lot of issues. Vaginal estrogen therapy is one thing that we can use. And we are seeing in studies that it is still safe, even if there is a personal history of breast cancer. And by the way, this is not family history of breast cancer as in great aunt or cousin had it. No, it has to be a first degree relative. Mother, daughter, sister had breast cancer, and usually at an early age as well. And then there's genetic testing. There's a lot of things that go into this. So it's not necessarily like across the board, absolutely not, never have estrogen or progesterone therapy. There are a lot of things that we need to talk about and dig in a little bit more to see what are your risks and benefits of doing this and what other treatment options do we have. It's all about risk, quality of life, and your past history. But using vaginal estrogen for those symptoms does not appear to increase the risk of breast cancer. And HRT is protective against heart attack, stroke, Alzheimer's, colon cancer, osteoporosis. So there's a lot of benefits to it. Sleep disturbances is huge. I get this all the time. There's a lot of women who complain that they cannot sleep, or they can't get to sleep, or they wake up in the middle of the night and then they can't get back to sleep. Super, super common. One of the things that can really contribute to this, especially early on, is that loss of progesterone. Progesterone, it's metabolized in the body, and one of the metabolites is called allopregnenolone. Aloe goes to the brain and has a very calming effect. So these are prescriptions here in the United States. You can get progesterone topical over the counter, but it's not going to work the same. You actually want the oral progesterone. We do have FDA approved micronized progesterone. You can get it from the pharmacy, and you take that and it goes through the liver, and through the liver, it gets metabolized. And then you get that allopregnenolone that then goes to the brain and has that calming effect. It can help with sleep. That is one of the treatments that we can use in addition to everything else that we need to do for sleep hygiene. I found this really interesting article in Harvard Health Publishing. Menopause and insomnia, could a low GI diet help? They looked at over 50,000 postmenopausal women, average age of 63, and these were enrolled in the Women's Health Initiative study that was between 1994 and 2001. We're still looking at a lot of the data that they collected. They collected so much data from this, and what's important about the Women's Health Initiative, the WHI, is that when it first came out, before even it was even done, there were some people who said some things, drew some conclusions about the data that later went back and looked at it and it wasn't true. Things such as HRT increases breast cancer risk. We're finding that's not true. And the increase, one more case that they had in the 50,000, was not clinically significant. And it was with certain formulations that we don't even use anymore. Unfortunately, a lot of providers out there are still basing their clinical decisions off of data that was misinterpreted, which is a huge problem. Risk of developing insomnia after a 3-year follow-up, which is pretty substantial, greater in women with a higher GI diet, as well as in women who included more added sugars in their diet. These included white and brown sugar, syrups, honey, and molasses. The risk of developing insomnia was lower in women who ate more whole fruits and vegetables. It is a high GI diet. If you're familiar with the GI effect of foods, we're talking about simple sugars. When you look at a nutrition label, underneath the carbohydrates, it breaks it down into the fiber, sugar, and then added sugar. So what we're most concerned about is those added sugars and having a diet that is not well enough balanced. If you're not eating enough protein with each meal, if you're not eating enough healthy fats, which is not vegetable oils, crackers, and processed foods, but those healthier fats, the omega-3s, the fatty fish, the grass-fed organic, and making sure that we're also having enough fiber in the diet. These things are super, super important and affects your sleep. Weight gain and metabolism changes. The menopause belly, we call it menopause, which is not a very flattering term, but what is going on with this? There's some women who come to me and they say, I have not changed a thing about my diet. I was always lean and active, and I've even taken up, I'm starting to do more cardio. I'm going to Orange Theory, I'm going to CrossFit, or I'm doing this, and I'm gaining weight. And I'm not eating anymore, or I'm trying to eat less and it's not working. I'm just gaining more weight. What is going on here? So it's a great question. This happens because, again, the estrogen level, as it starts to decline, estrogen was telling fat to go to places like hips, and it also was telling muscle to build. Estrogen is an anabolic hormone, as it turns out. So it builds muscle. When we start to lose that, we start to lose muscle mass and we start to accumulate body fat in the belly. This is concerning not just for aesthetic reasons, but also because it increases your risk for heart disease, diabetes, cancers. We do want to address this and make sure that we are implementing things that will help to reverse this process. And it is possible, by the way. For one thing, if estrogen is low, we try and either support the body to make its own estrogen or to supplement with hormone replacement. Can be appropriate for some women. We also look at nutrition. Going back to that study we talked about with insomnia, that same diet that is no added sugar, high in fiber. We're talking like 30 grams per day for women. Higher in protein, we're looking at 1 gram per pound of ideal body weight per day for women. And then lots of healthy fats, especially higher in omega-3 fats, such as from avocados, olive oil, fatty fish, and grass-fed organic beef. These things will help to reverse that situation. Again, anytime you put something in your body, It's giving the body a signal. Nothing is inert. We have to be very conscious of that when we're eating foods. It's telling our cells, our DNA, our things what to do. It's telling our metabolism what to do. We have to be conscious of that. Exercise. I know we, especially in this age bracket, we were really taught when we were younger that you're going to burn calories when you exercise. But unfortunately, especially through this transition, that is not what's going on with our bodies. The more we push ourselves to do more activity, more high intensity, more endurance training, the worse our metabolism is going to get. The body is very adaptive. When we do this, we're turning on the signals for fat storage because it's such a stressor. Many women going through perimenopause have worse cortisol regulation. Their body is stressed out because of the transition. And then we're stressed out because of life. And then we're stressed out because we're trying to do these things to get the weight off. It's the compounding effect of that that will cause the weight gain to really come on even more rapidly despite our efforts. And it's not so simple as, calories in versus calories out. It's more complex than that, though that still holds true. We have to work with our metabolism, not against it. That means strength training. That means building muscle. As we lose that estrogen, that signal to build, we have to manufacture the signal to build by using strength training and doing some sprint interval training. I have another video about that. That is not doing Orange Theory where you're 45 minutes solid of just trying to keep your heart rate as high as possible the whole time. For women going through perimenopause, that is detrimental to us. If you're younger, you can handle that, and that could be great for your weight loss efforts. But for us going through perimenopause, that's not beneficial for us at all. That causes more stress on the body. And though you may look like burning more calories during that session, your body will adapt after that workout and burn less calories at rest because it goes, oh, that was really stressful. We need to conserve energy because she's going to go and do that again. We're running from the tiger again tomorrow. Think about those signals that you're sending your body and how we can use those signals to get the outcome that we want, which we want a lean belly. We want more muscle mass because that equals more bone density. And that decreases our risk for osteoporosis as we get older, which is really important. Lifestyle factors include things like stress management that we talked about, anything that is calming to your adrenal glands. What is calming to your adrenal glands is things like yoga, getting enough sleep, difficult, right? Going through perimenopause, guided meditation, doing things you enjoy doing. When's the last time that you did something that was just for you? We, especially as women, we focus a lot on other people, and it's hard for us to put ourselves first. But if you don't fill up your own cup first, you really don't have as much to give. You want to give from the overflow, not scraping the bottom of the barrel because you have nothing left. Just think about it. And it doesn't have to take a lot of time. It can be just small things that you do to turn things around and take care of yourself and send that signal to your body that you are important and you need to, put your oxygen mask on first. Hormone balancing and replacement. So some things that I've used, especially in perimenopause, we don't necessarily need to go straight for the hormones. We might be able to just support the body through its own process. Say progesterone is low, we can use things like latex can help to stimulate the brain to tell the ovaries, hey, kick it back into gear here. And that can help with progesterone production naturally in the body. If the estrogen level is getting too high, which can happen, in the end, it goes down. But in the meantime, you're all over the place. So it can be high, and that might just be in relation to the progesterone. As the progesterone is low, it feels like estrogen is high, or maybe the estrogen is getting backed up in the body. If you have any kind of GI issues, if you have any liver issues, it can be very subtle. So we're talking about functional medicine. We're talking about optimizing ranges here. We're not talking about sick care. Okay. That's a totally other level. So we're trying to get it upstream a little bit further. When you go and you have your labs done by your primary care, they might be like, oh, everything's fine. Labs are normal. Well, they're normal for not being in the sick range, but that doesn't mean that they're optimized. And especially if you're still symptomatic, that's not the end of the story. Just know that. Don't just necessarily take that at face value. If you're still not feeling well, keep digging. Okay. Find another provider, find somebody who is specialized in perimenopause and menopause. Follow Dr. Marie Claire Haver. She's wonderful. She has her book, The New Menopause. And I have some other book recommendations too that I can put in here. But educate yourself. This is your health, it's your body. And we do have to take responsibility for ourselves and do not just place your care into that of a broken system, into insurance that they're not there to make you healthy. Making sure that we're looking at those things and applying care appropriately to optimize health, not just keep you from being in the hospital, because that's a sick care model. Let's talk about the healthcare model. Those are two different things. And then hormone replacement. Hormone replacement in perimenopause can and is appropriate for some women. To say that just because you haven't crossed that barrier, you haven't gone 12 months without a period and you're not in menopause, there's any benefits to starting hormone replacement early when it is appropriate and continuing on that. We used to think that you're going to be on the lowest dose possible for the least amount of time, but that's no longer the case, because the moment that we stop that hormone replacement, those benefits are gone, especially with the estrogen. And increased risk of breast cancer, really unsubstantiated. And it's protective to the heart, it's protective to the brain, it's protective to the bones. When we stop those things, that protection goes away. So women are going well past 65. The problem is if we start hormone replacement well after menopause, like 10 years after. And what if she has underlying atherosclerosis, which is arterial disease leading to heart disease, possible stroke? And when the arteries have started to harden, they've already gone down that road, and there could be plaques built up in there. What estrogen does is it makes those arteries nice and soft and pliable again, which is great, except if there are plaques already there, it increases the pliability and those plaques can break. And then that can lead to cardiac events, heart attacks. It can lead to strokes. That is a concern for sure. So she has to go through proper screening to make sure, and then have that discussion of that first year of treatment. If you're more than 10 years after menopause, there is a increased risk of having more heart disease issues because of these things that could be leading up to that. So that's something to be aware of. And this is just an article that I pulled up, weight gain in menopause. Hormonal changes across the perimenopause substantially contribute to increased abdominal obesity, which leads to additional physical and psychological morbidity. Again, it is possible to lose weight in perimenopause and through menopause, but it's got to be through the proper regimen. And every woman is a little bit different. And this is where this type of treatment can be difficult, because you go to your primary care provider and they've got 15 minutes and you have max of maybe 1, 2, if you're lucky, 3 issues that you can talk about. And that's why they typically give you medication. They don't have time to talk to you about the exercise regimens, about the diet, about the sleep, about the stress management. And oftentimes they're just not educated in those things either. That is why first of all, I don't take insurance, because I don't want to be restricted in my practice by what an insurance company tells me that I can do for my patients. That's not proper care. It is something that we still need to a certain degree, but I don't think it should be the only option that we have. So this is a different path that I have available. I go deeper. We have coaching programs. We have packages where I can dive in and get to the root cause of these things and then take the time that it takes, because it's not an overnight fix, unfortunately. I have had some women, though, that we put them on, a couple supplements that they needed, and within a few days, they are feeling just a million times better, which is awesome, but we're not done. There's still work to be done. So that's what I try and do in my practice, is I want to get the woman to the place where she has all the tools she needs. She has the education she needs. She understands her body. And we've also worked through a lot of her issues together. She has that confidence moving forward. And then it's not so much that she's dependent on me, but she can rely on herself and she can go out there and live the life that she wants to live. Here are some questions that I had submitted. How long do hot flashes typically last, and will they go away on their own? They can last from anywhere from a few seconds to several minutes. Frequency varies among women. And again, not all women are going to suffer from hot flashes going through perimenopause and menopause. And some will have mild, annoying, and some will have really severe where it's debilitating. They can't sleep. They have to leave work. It can be really bad. For some women, it can last for a few months. But on average, they persist for about 7 to 10 years. This is why to say that we're only going to put you on hormone replacement for, let's say that someone is being treated for hot flashes, because that was the thing that was like, we'll only treat menopause hot flashes, and we have treatments for that. To say you're only going to do it for like 2 years, 3 years is not enough. That's negligence, honestly, in my opinion, to have a woman suffer a lot needlessly. And it is needless to cut treatment short. They do tend to diminish over time and intensity. Most women will go through this phase and their hot flashes will eventually abate on their own. Okay. Next question. What are some natural remedies I can try to reduce the frequency and intensity of hot flashes? We have cooling techniques, dress in layers. You can use fans, stay in cool environments, crank up that air conditioning. Also, cold tubbing. Cold tubbing can help. That is exposing your body to those temperatures, either cold tubbing or even doing a sauna, which you would think would be counterproductive. But by exposing your bodies to these various temperatures, it resets that temperature gauge in your body that you're better able to regulate. And that's part of what's going on there is the regulation of the temperature. Internal thermometer is getting a little out of whack. That's the rewiring that's going on. Think about puberty. This is your second puberty. Your body was going through a lot of changes then and a lot of adaptations, and that head to toe, including your brain, is being remodeled. It's happening again through perimenopause. It's kind of going back to it's insane that we don't talk about this. It would be like if your daughter was going through puberty and you go take her to the doctor and they're like, I don't know what's wrong with her. Let's just put her on an antidepressant level. Dietary adjustments. We can also do things that talked about reducing caffeine, alcohol, really not good through perimenopause, but that will not help this. Spicy foods and then processed sugars can make it worse. We have herbal remedies, black cohosh, soy isoflavones, red clover. Some of these have been shown to be effective, and then other studies say not so much. I do not recommend that you start any supplement, though, without talking with a provider who is familiar with these things, who can also look at your other medications, supplements. Black cohosh, for example, has been shown in some rare cases to cause liver issues. That's something to be aware of. There, again, nothing is necessarily benign. There are some things that are safer than others, but this needs to be a conversation with a provider who can really kind of walk you through all of that. Magnesium and evening primrose oil are also popular choices, can help. Magnesium at night. Magnesium glycinate is one of my favorites to use with a lot of clients, especially at night, helps with relaxation and stress. And then stress management, yoga, meditation, deep breathing. These exercises can reduce the intensity of hot flashes. It's worth a shot. There's really no downside to doing any of those. And then regular physical activity, exercise can help with this. Like what happens when you're exercising, you are internally raising your internal body temperature. And again, whenever we expose our body to fluctuations in temperature, it just helps to reset the thermostat, make sure that our body can work through that and regulate itself. Why is it so hard to get a good night's sleep during perimenopause? And what can I do to improve my sleep quality? It's a really great question. It's common that we have issues with sleep during perimenopause, and it's not always related to stress. Sometimes it is, but it does seem to be that we're more susceptible to being stressed out. We're more anxious. We're more worried. And again, this is not because you're going crazy or anything. It's because of those fluctuations in those hormones. It can make you feel like you're losing it. So fluctuations in the estrogen, progesterone, these hormones influence sleep regulation. Their decline can lead to trouble falling asleep, trouble staying asleep, or waking up too early. What we can do. Step one is always to address the lifestyle. If we just throw you on a sleeping pill, it's not going to fix anything. And in fact, a lot of these sleeping pills, unfortunately, you do not like, it's a sedation type of sleep. It's not true sleep with deep REM and that restorative sleep that helps to heal the brain. Long-term sleep deprivation, we know, leads to higher risk for dementia and Alzheimer's, heart disease, diabetes, all of these things, because it is important. We have to have this time And especially through perimenopause and menopause, when our brains are remodeling because they're being exposed to different fluctuations in hormones, it's even more important that we get true restorative sleep, not just sedation. Do we use sleeping aids when we need them? Because, man, if you're desperate and you are exhausted and you cannot sleep, absolutely. It's like when we use, antidepressants and SSRIs. If you are clinically depressed and you cannot work, you're falling apart, you're maybe even suicidal. Absolutely, we use these things. These are life-saving medications, but we have to use it within the context of a holistic plan that addresses the root cause with the goal of getting them back off of these things once we're able to work through those issues. Creating a really good bedtime routine, making sure you have a cool, dark room, turning off electronics, or at least using those blue light blockers, and the screens have their settings that you can put to night mode and things like that. Decreasing stimulation during the evening, no food, big meal 3 hours before bed, maybe a little snack if you need it. Alcohol, definitely not a good thing to use. It might make you pass out sooner, but you're going to wake up. It's not, again, it's a sedation type of a sleep. It's not true sleep, and will make your sleep worse over time. Pick the alcohol. It's not, nightcaps are not good. It's not helpful at all. Work on getting that out of your lifestyle if that's something that you have been accustomed to. You can use chamomile tea. Chamomile is a known relaxer. It has things in it that will help your body to naturally relax and get ready for sleep. You can do reading. If TV calms you down, letting your brain to stop running on your own story and watching a story on TV helps you to fall asleep, do it. But again, be conscious of that blue light. That does stimulate the pineal gland, which is the little primitive part of your brain that goes, it's daytime. And you don't want your brain to think it's daytime because it's going to switch its hormones and you're not going to be able to sleep as well. Want to give it the stimulus that it knows it's nighttime, but it will do that. We talked about heavy meals, caffeine. Also, we want to make sure that we're not drinking too much caffeine later on in the day. Some people are more sensitive than others. Some people can have an espresso with dinner and then go to bed just fine and they sleep just fine. It's good for them. Magnesium is great to use at night. Melatonin can also be used to help with sleep. You want to start very low dose, see how you respond to it. And then there's cognitive behavioral therapy, which there are cognitive behavioral therapists out there that can help with that type of an issue. Okay, so I noticed weight gain, especially around my belly, even though I haven't changed my diet or exercise routine. What can I do to manage this? It's a great question. Again, we talked about weight gain earlier, but during perimenopause and menopause, primarily due to those hormonal changes, that loss of estrogen is going to tell the body to start storing fat in the center of the body, kind of more in that male pattern, because what happens is our progesterone drops, our estrogen drops, but the testosterone doesn't drop as quickly because we pump out a lot of testosterone from our adrenal glands. That will start to kind of kick in as far as the stimulus, and that fat will start to go towards the middle of the body, kind of more like that male, gut going on that you may not have been accustomed to. I've always had a nice trim waist, and now all of a sudden I've got this fat and I just can't get rid of it. I'm not even doing anything any different. I'm trying to lose it and it's not working. And this will cause a slower metabolism. The estrogen also and the progesterone helps with glucose metabolism. So you can see insulin resistance in this instance as well. And then the fat accumulation will increase that insulin resistance, increases the inflammation. It's a huge problem. It's more than just cosmetic, but it's metabolically disadvantageous and can be very harmful to our health long term if we don't address this. What we do is nutrition is going to be number one. I typically start people off on a no added sugar, no dairy, no gluten diet, just to eliminate those common allergens that cause a lot of inflammation in the gut. That is more pivotal than you realize. It's not just how many calories you're eating and how many calories you're burning. It's more complex than that. Inflammation plays a huge, huge role in that. So that's one of the things that I do. And it really helps people. They just feel better very quickly, very, very quickly. And really helps with weight loss as well. Body is able to let go of that fat. We have cardiovascular exercises. We can do walking, swimming, cycling, but these are not as much of a contributor to your weight loss as you might think. And in fact, what we need to think about is not burning calories, but as in building our metabolism. And by building our metabolism, what we do there is we do strength training. Whatever builds muscle will build your metabolism. What that means is that at rest, sitting here doing nothing, I'm going to burn more calories if I have more muscle mass. When we lose our estrogen, we start to lose that signal to build more muscle. You have to figure out other ways to send that signal to the body to build more muscle, to build our metabolism. We can tolerate eating a normal diet without going to extremes and still maintain a healthy weight. All right, so last question. Is hormone replacement therapy, HRT, necessary for managing menopause symptoms, or are there other options I should consider? HRT is definitely our go-to because it is very effective. What's going on? You're losing your estrogen. What's the treatment for that? We give you estrogen, right? But that's not always something that every woman either can take or even wants to take, which is totally fine because it's your body, it's your choice, right? If you decide that, I looked at the risk and benefits and I would like to try other options as opposed to going straight for hormone replacement therapy, yeah, let's do it. There's many other things that we can do. We start with diet, we start with exercise, lifestyle, sleep, and then supplements. Supplements include your basic nutritional supplements, the multivitamin, your vitamin D, and your omega-3s, and the magnesium. But it also includes herbal supplements, Vitex if your progesterone is low, which requires testing and diagnostics, or DIM if your estrogen is high. Again, requires testing and diagnostics to determine that. Don't just run out there and start taking supplements or herbal supplements based upon just your symptoms without talking with a provider who is versed in this. I did have a client come to me and she had this herbal supplement because I thought this was what was going on, but then I just felt worse. Yeah, because that's not what was going on. But I applaud you for trying. Do be careful. Don't just take whatever supplements that you hear out there because of this or that and you think it matches your symptoms. There are many different reasons for underlying symptoms. So you need to be careful. And not all of, again, not all of these herbal supplements are 100% safe. Some of these are pretty benign, but others could have side effects. And we need to have an evaluation with a provider that is versed in these things. I am, in order to make a safe plan for you. All right, you made it. Deeper dive. If you want to know more, if you go to Spotify, Anti-Gravity Wellness Podcast, episode number 15 is Master Your Sleep. We talk all about this good, long, deep dive into sleep, into things like hot flashes that can affect your sleep and all those other aspects there. Thank you, everyone, for joining me today. If you are on Instagram, on Facebook, on YouTube, and you want to learn more, send me a DM and say hormones. And I'll know that you want to talk some more about your hormones and what's been going on. I would just love to help you, even if that's not necessarily, you don't necessarily need to sign up for my services. I'm not trying to push anything on anybody. I just want to empower women to understand what's going on with their bodies. If I can help you do that, I would love to. Well, thank you everyone for joining me and have a great rest of your Friday and your weekend. Bye.